Thank you so much, Kris, for your great work and great presentation. Are you here already? Kris is joining us live from Seattle. Say hi to Kris, everyone. We have a lovely spread of people who are very interested with law enforcement assisted diversion. Now it's let everyone advance with dignity. There's a change of name. We'll talk about it later. We're seeing people from the government, from the judiciary, some judges. Hello, good morning po. Some people from the Department of Health, some people from the academe, of course. We have a lovely spread of the audience who, for the first time, will be hearing about law enforcement assisted diversion and even the concept of diversion. So let me just go back to the presentation. People who are supposed to go to prisons will not go to prison. They will be diverted, that's the idea, to a caseworker and later on to a public health professional if that is needed, or a social worker. Is that the general framework, Kris, of LEAD when it started?
I'm sorry, could you repeat that?
Just to outline to everyone who's hearing the concept of diversion for the first time, the people that are going to the diversion program are supposed to go to prison.
Oh, correct. So everyone, when we started LEAD, everyone that was coming in was someone who had committed an offense that they could have been arrested for, and that had they actually gone to court for, could have done time in either jail or prison, depending on their prior convictions and the amount of drugs they had on them. And then, as I mentioned at the end, since then we have expanded it dramatically. But the original incarnation for the LEAD program in Seattle and elsewhere was certainly people who were at high risk of going to jail or prison.
Yes, and that's the general idea that you were able to transplant in other cities and other states in the US. And my question, actually, just to clarify some of the concepts that you presented, was there a necessary policy change?
No, that's the nice thing about doing a program like this, is you actually do not need to change law or change official policy. What you do is you change practice. And I recognize that this is more possible in some areas than in others. But if you can get the police and prosecutors to agree to change their practice, this is an easy way of implementing it without having to go through the legislative process, which can be time-consuming and cumbersome.
I think most of our audience is really interested in knowing that there is no necessary law reform or legal reform that took place before LEAD was conceptualized and before it was actualized in Seattle and in other parts of the US. And it was sort of, because people are asking, do we need to decriminalize drug use or possession for personal use before we could institute something like this?
No, you don't. And in fact, that was not a discussion that was on the table in Seattle when we started. We still had very, very severe penalties for drugs, and we had police who were arresting large numbers of drug users every year. What is interesting has been that the more that we have done LEAD, the more people have come to say that the criminalization of behavioral health is something that does need to change. And so we've been working on that at both the local and the state level here to get these laws off the books and to try and have a more pragmatic, community-based response.
Change the practice.
Change the practice.
The message. We have some questions from people. Are you ready, Kris? We have some question from Maria Cecilia Zamora. Her question is, how are you able to gain the trust and confidence of people in the community with the police or law enforcement?
Ah,
Very interesting question.
and that's great because the resistance comes up a lot. I mean, when we first started talking about doing LEAD in Seattle, people were saying, why would we give money to drug users, basically, in the sense of providing social services? And so, what we did then was focus on the pragmatic aspects of the issue. And what we said was, well, you are dissatisfied with what the police and the prosecutors are doing now. You think that they're not doing enough. And what we're offering you is not less, but more. We are offering you this neighborhood more attention than it would otherwise get, but in the form of very tightly focused service delivery. And there were folks who were skeptical, for sure. But once they saw the program in action, some of those who were most skeptical became some of its biggest supporters.
Wow. And it took you how many years?
Oh, it took us, we were in the planning phases for over 2 years. And then, we operated as a pilot project for a couple of years. And then we started rapidly expanding.
She has a follow-up question, actually. Kindly expound on the role of people's participation in the community in harm reduction. After gaining their trust, after
Sure.
convincing them that this works.
So this was really important. So what we did was, in the pilot neighborhood that we started in, there were a couple of community-based groups in that neighborhood. One was an association of business owners. One was an association of residents. And I attended meetings of those groups monthly for several years. And would provide them with information about what we were doing and how the program was operating. And this gained their trust. They could see that we were actually as interested and vested in their neighborhood as they were. And that we were all seeking to achieve the same result, which was an improved quality of life for everyone. Not and when by everyone I mean including people who were engaged in drug use or prostitution, that their quality of life mattered greatly, and that if their quality of life improved, it might help the overall quality of life improved. And people began to see that and began to accept that, and they became big supporters of the program.
Really great. We have a question. Actually, this is also my personal question. This is from Greg Gray. And is asking about the perception from the broader community who typically have a negative attitude towards drug users. At least this is the case in Southeast Asia. And how, if at all, our broader community engage in the program? This is particularly referring to the stigma. How did you address the stigma that is attached so much to people who use drugs?
I don't want to sugarcoat, and I don't want to say that this issue is resolved. But because that is still there. There are still people, even in the neighborhoods where LEAD has been implemented and is successful, who still have very, very negative opinions of people who use drugs, or people with mental health issues, or people who are in poverty. They don't like seeing beggars. They don't like seeing homeless people. I personally wish that did not exist, and I personally wish that would go away. But I think this goes back to one of the things that I started with, which is, what we are looking for, even if it's not LEAD, if it's something else, what we are looking for is a more pragmatic, more practical, more humane approach to people who have behavioral health issues. And if we can just get people to the point where they agree on that, and they don't talk about the things they disagree with, that gives you an opening. And that if you can work on that, and over time, perhaps they will be more receptive. And I will say that in some of the communities we work with, some of the most conservative people in those communities have come around to be big supporters of programs like this.
Wow. Wow, that's so great to hear. And I love the idea of compassionate pragmatism. There's
Yes.
always the level-headedness into the idea of lead. It's not really something that is totally out of the box, should I say, but it's something that with common sense you can think about because it's very real, and the concern for public safety in the communities is also real. And it's really important, as I'm getting it from you, to have that common goal and start from there and have and build this collaborative effort that you were able to replicate in other parts of the US. We have another question. This is from our dear friend Mimi Banayat of IPG. This framework of diversion relies heavily on discretion on the part of the law enforcer. And aside from the assessment tools to help them decide on whether or not to arrest them or not, what are other safeguards did you put in place to avoid exploiting this discretion?
That is a great question. I mean, it really is because you are not going through a legislative or a policy making process to change it. You are in fact leaving it up to the discretion of police and prosecutors, which is why it is really important from the beginning to try and get them to agree to operate in good faith. And there's things that you can do that police themselves have adopted. So, for example, in many police departments, both in the United States and in other countries, police officers are, in a sense, rewarded for making arrests. In many departments, getting promoted is based on, the officers that make the most arrests are the ones that get promoted, or they get assigned the best districts to work in. So one of the things that a superior officer can do if they believe in this program, and that happened here in Seattle and elsewhere, was the superior officers told the frontline officers that making a lead diversion would count the same as an arrest when it came time to their annual assessment. So in fact, officers were rewarded for making a diversion the same way they would have been rewarded for making an arrest. So that removes any incentive that the officer has to just make arrests. So that there are a variety of things you can do. And what I would say to that front is, and I've done this for the last several years, is you need to look specifically. There's not a global answer to that question. The answer to that question is really going to be locally and culturally based. So what is the culture of the police department that you're working with? What's the culture of the community that police department is in? And trying to figure out how to navigate that in a way that makes sense.
This is really mind-blowing for most of our audience and even to me, because the idea of indicators of success, because for police officers or for those people in the law enforcement, it's the number of arrests. It's the number of people you put into jail, you are recorded, you charge with an offense. And this is really a great idea to incentivize them, to divert them instead of arrest them and count this as a success.
Exactly. And see, that's part of the problem is that in many areas, police departments do have an incentive. The metrics by which they are judged are arrests. And the metrics by which prosecutors are judged is conviction. Success rate. And so the more people that the police arrest, and the more people that prosecutors can successfully put in prison, that makes them look better. So what we need to do is change the whole metric of evaluating police and prosecutors, so that maybe, for the entire police department, it is a decrease in arrest of people with behavioral health issues that should be the metric for success. And I mean, certainly in the United States, this is a very big issue at the moment. You know, for years now, people in the United States have recognized that there are enormous racial and ethnic and class-based disparities in our criminal justice system. And this issue is huge in the United States at the moment right now. And so the conversation is ongoing about why in the world do we have police respond to someone with a behavioral health condition. In many cases, that interaction goes bad because the police don't have the skills. They've never been trained. It's not that they can't do it, it's that they've never been given the training on how to do de-escalation and how to interact with someone. But the thing is, we have people in the community with that expertise. And the conversation now is, wouldn't it be better if people with that expertise were the ones to respond?
We have been hearing some of the same statements from people in the government, people from our Department of Health, people from the local government, that people who are using drugs or substances should not be sent to jail. It's a public health issue. That is something that is more or less commonly agreed upon. And it's great that LEAD started from that very same agreement amongst community members, even amongst law enforcers, prosecutors, and those who are over the years traditionally conservative. But you were also talking about the culture, the localization of some of the program, how it was transplanted in some other states. And we are very particularly interested in that because there's a question about establishing an enabling environment. How do you do that? Most especially in maybe some of the states or cities where it was transplanted, there are lack of resources. Some law enforcers are more conservative, or even in the US, because there's a defund the police movement, and there have been so many cases of police brutality that's the same story here in the Philippines. How do you build that enabling environment for such a program to exist?
I mean, I think the only way you can do it is to get people to agree to try and do something different. And then if it's successful, and I firmly believe that these programs are successful, and again, I'm not specifically saying that anyone should do LEAD. There are different models out there. So for example, in one US city, it's a medium-sized city in the United States on the West Coast. For those of you who are familiar with it, it's the city of Eugene, Oregon. Many, many years ago, they made a conscious decision that when they got emergency phone calls and it was flagged as someone with a behavioral health condition, that they would have a community-based service provider respond to that. And in the years that they've been in existence, those service providers have only had to call the police for help a handful of times. And so this is just trying to reorient how we respond to what we previously have identified as criminal behavior, and address it that way.
Just a follow-up question. Some notable variations in the LEAD program, in the design, in some other city or states where you were able to transplant your ideas. Some notable variations you can tell us?
Sure. I mean, it depends. I mean, there are some cities that only do an arrest-based diversion, right? So where police have grounds to make an arrest and they don't, and they divert. So some cities only do it that way. Other cities only do social contact diversions, which is where the police just identify folks in the course of their work. Some places have been remarkably expansive in the range of offenses that they will divert for. Other cities have been very, very narrow. What I can tell you, though, is that our experience has been that you start with whatever you can start with, because what has happened consistently is that we have seen places that have implemented LEAD or something like it, that once they see that this approach is more successful than a criminal justice system approach, they are more than willing to expand. And no city that has done it yet has contracted. The pattern has been for them to expand the areas and expand the eligibility offenses, because it gives them better results. And you know, to be honest, most police and most prosecutors, in my experience, there are some that are very ideological, but most of them are really pragmatists. They are looking for what makes their job easier. If nothing else, that, you know, when I say pragmatist, I'm just saying, you know, the average police officer would do anything to make their job easier. And if you give them something that makes their job easier, they embrace it wholeheartedly. Most police officers, quite honestly, do not like interacting with people who have behavioral health issues. And so if you tell them that they won't have to do that anymore, for many of them, that's a win. That's a plus.
Give them less difficult tasks, make their jobs easier. That's the
Yes.
that's the
Yes.
key. It's really great that you mentioned this. Start with whatever you can start with.
Yes.
Because contexts are different.
Correct.
Our
Absolutely.
costs are different. Our communities are different. But the idea is there. And I like a part where you said that it's you have to experiment, because some policies don't work and you have to change them. And you just have to start and believe in something that will change and will produce positive outcomes. And this question is actually about that. What is your personal journey towards LEAD, and how did you start with your personal belief that this kind of program will work?
Well, that's an interesting question, and it goes back at this point almost 30 years, over 30 years. I got very involved as a volunteer with HIV prevention efforts with people who use drugs in Seattle, and so I was part of a group that started a syringe exchange program here back in 1989. And I spent a lot of time as a volunteer at that program. I was working as a researcher and evaluator on HIV prevention programs at the University of Washington at the same time, but I volunteered there. And one of the things I rapidly discovered was, in interacting with individuals who used the exchange, was when they talked about their trauma, when they talked about the things in their life that had hurt them, drugs were usually not part of that conversation. When they talked about what hurt them, it was frequently their interaction with the criminal justice system. And I realized that for many of these individuals, the most traumatic thing that was going on in their life was getting arrested and being put in jail and being prosecuted. And you know, yes, they were violating the law, and the police were doing their job. But it made me start thinking that that the criminal justice system itself was a source of profound harm. And I began thinking about, well, how can we reduce that harm? And interestingly enough, there were other people who were thinking along those same lines. And in the late 1990s, I got hired as an ethnographer and a consultant by one of our local public defense agencies to document racial disparity in the criminal justice system. And that led directly to the conversations that resulted in LEAD, where we started saying, what if we could get the police and the prosecutors to step away and to let civil society step in to address these problems.
You mentioned about harm that's not coming from the substances that they are using or they have consumed at one point in their lives, but the harm that the criminal justice system has put them through. That
Absolutely.
is really something that we have to think about here in the Philippines, because we have been bombarded with messages of the harm of the substance.
Right.
Harm reduction in terms of, what drugs are bad. But we
Right,
haven't
and
thought about the effects of the criminal justice system.
exactly. And I mean, I think this is really the root here, is that we've criminalized behavior over the years, and we've done that without thinking about how profoundly harmful criminalizing behavior can be to someone. Just the act of getting arrested can be profoundly harmful to a person's life trajectory. You know, you spend a few days inside a jail, you might lose your job, you might lose your housing, you might lose custody of your children, you might be unemployable when you come out because of that. So instead of actually helping those people improve, we've created barriers that make it almost impossible for them to improve.
We have a question here, because we're talking about the criminal justice system now. What are the role of prosecutors and judges? When police officers arrest a drug user, they're usually indicted. That's very automatic, detained and arraigned. It's beyond the police. Should prosecutors and judges be involved? Great question. From Facebook, live on Facebook.
It's a wonderful question. And what I would say to that is, in your best case scenario, you would have all of the players in the criminal justice system involved. When we started, we did not include judges, but we had a prosecutor who was very eager to try something different. In the United States, prosecutors are elected officials. I'm not sure what the case is in the Philippines, but our prosecutor said, I'm not going to lose re-election for not arresting drug users. I'm going to lose re-election for, people's cars and houses being broken into, and things like that. And so he was more than willing to try this approach. That was good. And we had police officers who were willing. We didn't have the judges involved at first, but if you can get them all involved, that's best. But you really don't need everyone involved to do a successful type program like this. If the police just don't arrest people, then the prosecutors have nothing to prosecute.
Yeah. This is pre-arrest diversion. So you will not have contact with the prosecutor, and you will not have contact with a judge for this particular instance.
Yes.
Okay. That clarifies lead for most of our audience who are judges here. I hope there are prosecutors, and I hope there are some law enforcement people from the law enforcement who can actually think about the law enforcement assisted diversion. This is pre-arrest, so they will not have criminal records. They will not be brought to a detention facility.
And that's the beauty of doing a program like this, is that, I will, honestly, very, very few of the people that we worked with in Seattle had never been arrested before. Many of them had been arrested multiple times. But for those where this would have been their first arrest, yes, this is beautiful, because this means they will not have an arrest on their record. They can escape that entirely. So that the jeopardy to being able to obtain housing or to be able to obtain employment is eliminated.
I'm just following through that flow chart in my head. So you're not going to be arrested, and then you are brought immediately to a caseworker, case manager. Is that correct? And then there's a question, where do you bring them? Which government or non-government sectors do you usually refer them for support?
Sure. So in the ideal model of how this would work, and again, it may differ from city to city or area to area, and there can be differences. But in the ideal model, instead of making an arrest, you have a police officer call someone. And what that someone is referred to differs. Some places refer to that person as a case manager, some places refer to it as a social worker, other places refer to it as a care navigator or a care coordinator. It really doesn't matter what you call the person, but what happens is the police officers call that person. That person shows up on the spot. And then
24/7.
Yeah, 24/7.
Oh, wow.
And then that person and the individual who was going to be arrested walk away together. The person's not in handcuffs. They're entirely free to leave if they choose. And then, the worker begins to establish a relationship with the individual to identify what his or her needs and wants are, and to work with them on that. And as I said in the video presentation, we knew going into this that the range of needs and wants was probably going to be very, very large. And so we didn't establish anything about what was on the table or what was off the table. So if the person flags that they want substance use treatment, we'll get it for them. If the person flags that they want mental health services, which usually does not happen, at least initially, quite often they have physical health issues that they need addressed. Often they need housing. Often they need help getting legal identification. The majority of our people have no legal identification at the time that they're diverted. So we work with them on a wide range of needs. And as I said before, nothing is predicated on, or there's no precondition that the person has to stop using drugs to get those services. They get the services regardless of whether they keep using drugs or not. And I know, and what I will say is, in answer to that, I missed one part. Our experience has been that civil society is much more able to provide these kinds of services than governmental agencies are, which is not to say that civil society members don't access governmental services, but they serve as the mediator or the broker for that. Our experience has been that civil society groups are more knowledgeable about the population and more flexible and more able to adapt to circumstances. They don't tend to be as bureaucratic.
Mediator, that's the role that the civil society organizations play in the whole flow chart, as I call it, for the diversion program that you were able to establish in Seattle. And there's this question, very important question, about how you train police officers. They're very specific question. How long does it take for police officers to complete the training?
Great question. And so our experience right from the beginning was, and a police officer actually said this to me. She said to me after she had been doing lead, she said, when I went to the academy to be trained to be a police officer, I was taught how to shoot accurately, how to drive fast, and when to make an arrest. And she said that she had received not a single minute of training in chemical dependency. She had received not a single minute of training in mental health. She knew nothing about drug treatment. And most of the officers that we work with assumed that if an individual wanted treatment, they could get it. They were flabbergasted when they found out that the waiting list, when we started, that the waiting list for publicly funded methadone treatment in the city of Seattle was 9 months long. That if someone wanted treatment that day, they were going to have to wait 9 months before treatment was available. They were shocked and horrified by that, but none of them knew this. So when we did our trainings with them, and time is very valuable to police officers and to police agencies. So you need to be as succinct as possible. You can't go in thinking that this is going to be a graduate seminar and you have a couple of hours. You need to go in thinking, I need to get this done in 10 minutes. And so we did this in 10-minute chunks of giving them just basic education in, they think they know a lot about drugs because they arrest drug users, but they often know very, very little, or what they do know is sometimes incorrect. So going in and giving them a fact-based, easy to understand explanation of the drugs that people are using, the effects that those drugs can have on people, and then giving them an explanation of what drug treatment is, where and how to access it, what social services are. These are things that police just don't receive any training in. And I will say, just as an aside here, one of our experiences has been, and I worked at the University of Washington Medical School on this, one of our things has been that doctors often receive very little training. They receive training in, they receive training in pharmacology, in prescription medicines that they're going to be prescribed to people. They do not get trained in recreational substance use. And so working with doctors and other healthcare providers so that they understand what substances people are using is also important.
Yeah, and I think even lawyers and social workers.
Oh, absolutely.
I
mean, yes, many lawyers are going into court, prosecuting people or defending them without having any knowledge of the substances that a person is using, and social service availability.
And just a follow-up question, was that training required if you're going to establish a lead program? Does the higher ups in the police department require their subordinates to undergo?
Absolutely. And again, what we see is an enormous range of variation. You asked about variation before. So some departments, like for example, I mentioned in the video Albany, New York. This was the third city in the United States to do lead. We were very fortunate in that the chief of police for that department was very committed to this program. And he trained every single officer in the department in the program. And it was mandatory. They had no choice. And in other places we've been, only a small number of officers participate in the program. And so, yes, they receive training, but it's not department wide.
And it's drugs 101, right?
Yes, absolutely. Yep.
Basics. There's a question here about, did the nature of drug offenses as victimless help shift perspective, specifically for law enforcers, I think, and even community members?
Sure. Go ahead.
When you think about drug use as a criminal behavior, as is stated in the law, in our laws, and even in some laws in the United States, how do you sell the idea that they shouldn't be arrested, and how does the victimless nature of drug use, possession for personal use, even selling, not harming anyone, how do you sell that to police officers and members of the community who really think this is criminal?
I think you avoid that issue as long as you possibly can. Yeah, to be honest with you. Because
why is that?
Well, because I think that if you start talking about people's ideas and their ideologies at the start, you leave people aside, or you run the risk of not having them involved. So, for example, let's say you're working in an area where there is a high degree of shoplifting and people breaking into houses or breaking into cars to steal things. They are not going to see substance use as a victimless crime. They're going to say those people are breaking into my house or stealing from my business to get money to support their drug habit. So I would avoid that to start with, because if you can see that they get better outcomes, then you can say to them, well, wouldn't it make more sense if we just decriminalize these substances and made an approach where they weren't as expensive to get? Because quite honestly, the reason drugs are expensive is because they're illegal. If they weren't illegal, they would be nowhere near as expensive as they are. So, but that's a long-term project. That's not a project that you can do in the short term. In the long term, over 5 or 6 or 7 years, you can start having conversations about, doesn't it make more sense to just fundamentally shift the entire approach? But for right now, what people are interested in, that business owner is worried about that person who is smoking drugs in their doorway or injecting. And so if you can say, what if we had a program where that person was not doing that at your business anymore? That's your buy-in.
Okay, and that's
just my opinion. I'm not stating that as fact. I'm just stating that's my opinion.
But you're walking us into the process of negotiating what can be the eligibility criteria. That's the step one, right? In establishing
absolutely.
the program. So, and it varies in most jurisdictions because you have to negotiate the concerns of business owners, community members, parents, law enforcers. Right. And you have to have that buy-in. That's very interesting. And I suppose that differs in a lot of contexts, but we've talked about making jobs easier for the police. How about the community? And let's talk about the results of lead.
Well, sure. And so what I will say is that we have incredibly good evaluation results on recidivism, repeat offenses. We have great results on cost. We have good results on outcomes such as housing and employment. And we have very, very good qualitative evaluations based on participant perceptions of lead, and they speak very, very highly of it. What we don't have is a community-based evaluation. And, if I could hit rewind and go back to our design process, I would have included a community-based evaluation, and I would have done a survey of the community before we started of what their perceptions of public safety in their neighborhood were. And then I would have done repeated the exact same survey 2-3 years after we had implemented LEAD, because I'm reasonably confident. I'm more than reasonably confident. I'm convinced that the outcomes would have been very, very good, but I can't prove that. And so I have suggested to other areas that are doing this type of program that they do some sort of evaluation like that, because I think the results would be good. And the reason I think this is because people have gone to city government and asked that their tax dollars be spent on this program. And generally people don't ask for their tax dollars to be spent on something that they don't like. So, that seems to me to be a good indicator, but, no one in the research or evaluation world would take that as evidence.
I remember in your presentation, there was this person who asked, why does Belfast has a lead and we don't? And that's very relatable at this moment. Why do you have lead and we don't? And of
Hmm.
course, the answers will be controversial. But another controversial point that I got from you is costs, taxpayers' money. Lead
Hmm.
cost less. It's cost effective. Can you expound on that? How is it cost effective than what is currently, well, for the Philippines, law enforcement heavy, punishment heavy? Just
Sure. And so this is one of those things where I'm never sure how much it applies to another country like the Philippines, or any other place. Um, for us in the United States, the criminal justice system, it consumes a lot of money, a lot of resources. There are some cities in the United States where over 60% of their annual budget goes into police, prosecutors, judges, and jails. Uh, that's a lot of money, and that's money that could be spent on many other things that people in the community want. And so, if you can get to the point where you're not spending that much money, uh, that's a win. And so we were able to show that doing lead was cheaper than using the criminal justice system and yielded better outcomes. And when you think about it, that's pretty remarkable that it's actually cheaper to provide someone with housing and with health care and with resources than it is to arrest them and put them in jail. And I think that when people realize that, and again, you're getting to the issue of a pragmatic response. When we were able to show that doing this was actually cheaper, people really went for it. When we were beginning LEAD, at that time, the city of Seattle was debating, the city council was debating building a new jail. Uh, and that was going to cost over $100 million. And nobody wanted to spend that money. So that was one of the reasons why the city council was willing to embrace this approach. Because if they could get away with not having to build a new jail, that would free up money that could be used for other things. And what I will say is that for the last couple of years, a couple of years ago, they closed down an entire wing of the jail. They just shut it down. And today it's being used as a homeless shelter uh, because of programs like LEAD.
that's very, very interesting. We are actually selling you, our audience, the lead program. It lessens recidivism, it lessens reoffending, and it's cheaper. I think that's very pragmatic. That's common sense. And I like the idea of you don't just divert people, you divert funds
Yes.
in the government. It's a hard-earned taxpayers' money. And if we could divert them from law enforcement into housing, into healthcare, into education, that would be more cost-effective and the results would be definitely significantly better. And I like the idea that this is spilled over into, it's just a law enforcement assisted diversion, and it's a criminal justice uh, system feature, but it's spilled over into a policy for the betterment of the community and wise
Yes.
use of public funds. Really, really outstanding results from Seattle and from the great, great work of LEAD. There's just one question, because now you have change of government and you have a Democrat in the White House, but there's also a movement to defund the police and do some significant policy changes in the US. How do you think will the Biden administration change the approach of LEAD? Or has there been any
Oh, I,
developments?
I think it's going to be enormous. When the Obama administration in the last 2 years of the Obama administration, the federal Department of Justice embraced LEAD, and they came out with a plan for 21st century policing. And LEAD was specifically identified in that plan as a promising approach.
Wow.
Other elements of the federal government, based on the evaluation data, have identified it as an evidence-based practice. That all disappeared during the 4 years of the Trump administration. And we had an attorney general who refused to acknowledge state-level policy changes in drug laws and called for harsh sentences for drug users. It's going to take some time to undo that. The Biden administration's only been in office 105 days or something like that. It's going to take some time, but we're seeing this already. Memos have gone out to attorneys, US attorneys in all of the states saying, basically, stand down on prosecuting drug use. And there is tremendous amounts of new funding that is coming through right now that for the first time is making substantial resources available for harm reduction-based programs. So syringe exchange programs and other community-based harm reduction programs, for the very first time ever, are going to be getting substantial financial resources. And the Biden administration definitely has seen what has happened around the United States for the past year with the attention to Black Lives Matter and the conversation around defund the police. Now, Biden is never going to use the word defund the police, and I don't think anyone in his administration is ever going to use that phrase. But I don't care what the phrase is. I think the pragmatic reality is they are going to be making money available for critically needed social services. And they already, in a way, even though they haven't used the phrase defund the police, they have effectively done so. They have canceled programs that make surplus military equipment available to police departments. For years, the military has given police departments in the United States surplus military gear, all the way up to almost tank-like sized vehicles. That's not going to happen anymore.
Wow, that's really great. And I know this from the human rights advocacy in the Philippines, we always say that progress is not linear and there will be setbacks, but you're on track. LEAD is on track. And those are great updates from the US. There's also a comment here from the city of Malabon that if we will adopt this program, this will decongest our jail. That's another agenda. We just hope this will be in the agenda of our government. Yes, you closed a wing of detention facility. That's really something that will be an direct effect of the LEAD program, jail decongestion. Thank you so much for all your questions. And if you want to talk to Kris, you can contact the organizers. Kris, thank you so much.
Absolutely.
For joining us, for always being there to Filipino harm reduction advocates, and for always educating us and inspiring us with your work in LEAD. That's now what let everyone achieve dignity. Advance dignity. Sorry.
Yes.
And sure.
Thank you for having me. It's always a pleasure to work with you, and I'm so profoundly respectful of the work that you and other folks in the Philippines harm reduction world are doing. I'm happy to help out anytime, and it's always a pleasure. So thank you.